Children are at risk of suffering from immunological diseases as parents skip immunizing their children due to strict coronavirus disease of 2019 COVID-19 guidelines that were set by government in Uganda. In the month of March 2020, the government of Uganda made a total ban on private and public transport plus unnecessary movements as a way of controlling the spread of COVID-19 in the country, something that affected many activities, immunization exercise inclusive. At Mbara Municipal Council Health Center 4, they used to receive between 46 to 50 numbers of parents every day bringing their young ones for immunization. But during COVID-19 total lockdown, the facility would barely receive any parent, or it would only receive 6 maximally, citing fear that there might be an outbreak of immunological diseases, especially measles.
I have fear that if the Ministry of Health does not organize for mass immunization, might lose many babies. Very few turned up during COVID-19 lockdown. Measles should be handled first.
However, this alarm comes at a time when the Ministry of Health has not made any plans to do mass immunization, but the Mbara Assistant District Health Officer in charge of maternal health has called upon mothers to find ways of reaching the hospital and getting their children immunized.
Maybe at the Ministry of Health there may be a plan, but for us as a district we don't have a plan for mass immunization. What we have done is to encourage the mothers, caretakers, if your baby missed any vaccination, it's not too late. They can still go back to the health facility and get the vaccination. The vaccines are available and you don't have to wait for a mass campaign to immunize your child.
According to the 2015 World Health Organization UNICEF estimates, the national coverage of DPT-3 was 78% and measles was at 82% in Uganda, which shows that 22% and 18% respectively of the children are still missing for these vital vaccines. Hence, Uganda is ranked among countries with the highest number of unimmunized children. Priska Natkunda, the health in charge Kakoba Health Center 3 in Mbara District, who preferred to be off camera, says that the center has one day for immunization in the whole week, which is a Wednesday, citing the problem of poor staffing and lack of refrigerators to keep the vaccine safe. In Chegegwa district in western Uganda, in the villages of Busasi and Chakatwanga, mothers regret COVID-19 and attribute their failure to immunize their children to local defense force who enforced COVID-19 guidelines on transport minus considering vulnerable groups.
COVID-19 affected me because I had to walk on my legs up to the hospital here. Long distances, no borders. For sure I had to struggle. Up to here. After, I had to go in the village. When I reached the village, I missed. I had to miss two times when I was going back for immunization, because there was no transport, even money, there was no money, high costs transport. I had to miss 2 times. Until now I've struggled, reached here, I've told the nurse has told me it's okay, they've immunized my baby. I'll be coming any other time.
In other cases, it was discovered that COVID-19 is a disease that put many people in panic, and doctors inclusive, which led to suspension of some services at a certain stage in the month of March 2020, but later communication was made and such services resumed.
When the lockdown affected maternal child care services in Mbara district and surrounding districts and then over the whole country, and mothers attending antenatal form challenges accessing the health facilities, And at first, some health workers thought that you were not supposed to do immunization during lockdown, but that was later clarified. The immunization sessions at the health facilities were encouraged, and even the outreaches were encouraged to continue.
Though even when COVID-19 guidelines have been revised and there is free movement of both public and private transport, some mothers are not bothered to take their children for immunization, giving mixed reactions.
COVID-19 found when my child had gotten only polio vaccine. I now fear to take the baby for immunization. I have taken so long to take him for immunization, the nurses will abuse me and even send me back home.
Children did not only miss immunization, but even those who were suffering from other illnesses, we lost them. We could carry children who needed emergency and trek long distances to access hospital. Others died. Nevertheless, through determination, some women made it and their children became immunized.
It is 15 kilometers from my home to the hospital where I immunize my baby. But I wake up early at 6 a.m. I'm already on the way to the hospital. It takes me 2 hours of going and 2 of coming back.
To close the gaps in immunization, hospitals have come with outreaches that reach near the villages where mothers stay, and this is to help have all children immunized to reduce the number of children dying from immunological diseases.
Like for us in Kabarole district, we see that most health center 3, they all have immunization for outreach sites where they go to offer these services, immunization services. However, we find that uptake is now high. These diseases that are preventable, for example, measles, I think you see now, measles is now not a big problem to this district and even the country at large because it is being immunized, so we see minimal cases of measles coming up. It is because of immunization. Polio, we are almost about to eliminate polio because of immunization, and this immunization, it is mainly through outreaches and of course, outreach services, because we are reaching out to these mothers and the children mostly.
And that's why now we are vigorously trying to make sure that we capture all those children that were not immunized during that time and make sure that they are immunized. We have opened up more outreach services for immunization. We have strengthened static immunization services at health facilities, and we have at least increased on the number of days for immunization at the facilities, such that a facility immunizes every day. We don't miss any child, even any child who comes, say for example, at OPD. When he is found that he was not immunized, he is taken for immunization, as he also gets other types of treatments.
The other is people are taking roles. We are not working alone as the health department, but we are also involving the community, and where we are working together with local leaders in those communities. As I told you, those sites that we go to, the outreach sites that we go to give a service as health workers, those sites were identified by the community itself, working together with the local leaders. So they identify for us those sites. They can be schools, they can be near a market, they are the people who give us time. We should go there. They know their communities well. We plan with them and they tell us the best time. Some communities, they first go to do some work like digging if it is a season of planting. So they will tell you, for us in this community, it is planting time, so come in the afternoon. So that the time they give us is the time that we usually follow and go to those outreach sites. So even the day, they select the day, the best day for them, So we go there, we plan for those days, and we plan for the time they tell us, and even the site itself, it is planned by the local leaders.
These outreaches, if they can be doubled, Uganda will start to receive good reports on closing the gaps in accessing health services that are being raised by mothers and other incoming patients at large, especially the problem of trekking long distances, as outreaches is a move to bring the same health services that are given in hospitals near to the common man in their localities.
They must be in a distance of at least 5 kilometers away from the facilities, the nearby facilities, health facilities. So we think that is a distance that now is covered for the mothers or for the caregivers that bring these children to the facility. So we come close to them so that they are able to come within their reach, to those sites which are within their reach, and they are given those immunization services. So it has really helped the communities in terms of uptake of immunization services. They bring their children, they are vaccinated against the vaccine-preventable diseases like measles, polio, hepatitis B, and even HPV, human papilloma virus disease, which causes cervical cancer. So we immunize them when we reach them. And also the costs. When these mothers or caretakers are bringing children to the facilities, they use transport, there is time wasted or used. So we minimize those costs, the time and even the money they use for transport. So this transport is provided for a few people, the health workers that take these services to those immunization sites, and then the mothers don't use transport to come to those sites because it is within their reach.
In Uganda, over 11 diseases are being immunized to protect children from the serious diseases and also prevent the spread of those diseases to others. According to the report made by World Health Organization in 2016, immunization is a proven tool for controlling and eliminating life-threatening infectious diseases and is estimated to avert between 2 and 3 million deaths each year. Over the years, immunizations have prevented epidemics of once common infectious diseases like measles, mumps, and whooping cough, and because of immunization, eradication of other diseases like polio and smallpox has been achieved in Uganda. I'm Sarah Mubiru reporting from Uganda.